Canadian Medicare is the name for our country's publicly funded healthcare system. It's designed to provide universal coverage for medically necessary healthcare services. So, in principle, every Canadian resident should have access to doctors and hospital care, no matter their income or social status. The system isn't a single national plan, but rather a decentralized collection of provincial and territorial health insurance plans. All these plans, though, have to follow national principles set out in the Canada Health Act. This framework really helps ensure some consistency across the country, aiming to provide care based on need, not on the ability to pay. Honestly, this commitment is a core part of our Canadian identity. One of the defining features of Medicare is that patients aren't typically charged directly for most physician and hospital services. Instead, the system is mainly funded through general taxation. That includes money collected from personal and corporate income taxes at both federal and provincial levels. The federal government also provides financial contributions to the provinces and territories, called Canada Health Transfers, to help support their healthcare costs. Thanks to this funding model, when you visit a doctor or need hospital treatment for an insured service, you usually just present your health card, not your credit card. This approach removes financial barriers at the point of service, which is a key part of accessibility. The Canada Health Act, passed in 1984, is the federal legislation that outlines the conditions provinces and territories must meet to receive federal funding for healthcare. The Act enshrines 5 key principles: public administration, comprehensiveness, universality, portability, and accessibility. Public administration means the provincial health insurance plans must be run by a public authority on a non-profit basis. Comprehensiveness requires that all medically necessary services provided by hospitals and doctors are covered. Universality ensures that all insured residents are entitled to the same level of care. Portability means residents remain covered when they move to another province or travel within Canada. Accessibility ensures reasonable access to services without financial or other barriers. What this system means for people living in Canada, including Calgary, is a significant sense of security. Knowing that essential medical care is available without the fear of crippling medical bills provides immense peace of mind. If you or a family member gets sick or injured, you can seek medical attention knowing the cost of essential services is largely covered. Of course, this doesn't mean the system is free of challenges. Issues like wait times for certain procedures are well documented. Still, the fundamental promise of Medicare is that healthcare is a right, not a privilege, a principle that really shapes the Canadian approach to health and well-being. In Alberta, including the vibrant city of Calgary, healthcare delivery is overseen by a single entity, Alberta Health Services, commonly known as AHS. AHS was established in 2008, consolidating what was previously a more fragmented system of regional health authorities. Its mandate is to provide a patient-focused, quality health system that is accessible and sustainable for all Albertans. This means AHS is responsible for planning and delivering health supports and services across the entire province. From the largest urban hospitals to small rural clinics, AHS coordinates the efforts to meet the diverse health needs of Alberta's population. It's actually one of the largest employers in Canada. Within Calgary, AHS plays a critical role in managing the full spectrum of healthcare services. This includes the operation of major hospitals, urgent care centers, community health clinics, mental health facilities, and addiction treatment programs. AHS is also responsible for public health initiatives, like immunization programs, health promotion, and disease surveillance. For Calgarians, AHS is the face of the public healthcare system. Whether you need emergency surgery, a routine checkup at a community clinic run by AHS, or support for a chronic condition, AHS is the organization facilitating that care. Its presence is felt in virtually every aspect of health and wellness in the city. The scope of services provided by AHS in Calgary is vast and comprehensive. Acute care services, including emergency departments and specialized hospital units, form a major part of its operations. But beyond hospitals, AHS delivers important community-based care. This includes home care services for individuals needing support to live independently, long-term care facilities for seniors and those with complex needs, and various public health programs aimed at preventing illness and promoting healthy lifestyles. Mental health and addiction services are also a key focus, with AHS providing a range of supports from counseling to inpatient treatment. This integrated approach really aims to provide a continuum of care. Accessing AHS services in Calgary can happen through multiple channels. For urgent or emergency situations, people typically go to an AHS hospital emergency department or an urgent care center. For non-emergency issues, many Calgarians interact with AHS through its community health centers or by calling HealthLink at 811. HealthLink is a 24/7 telephone service staffed by registered nurses who provide health advice and information. AHS also manages online portals and resources to help Albertans navigate the system and access information about their health. The central coordination by AHS aims to ensure that services are delivered efficiently and effectively across Calgary. Calgary is home to several major hospitals, each playing a vital role in the city's healthcare network under Alberta Health Services. The Foothills Medical Centre stands as one of Canada's largest hospitals and a leading academic centre. It's renowned for its comprehensive range of services, including being a Level 1 trauma centre, meaning it handles the most critical and complex emergency cases. Foothills is also a major hub for specialized care, with advanced programs in cardiac sciences, neurosciences, cancer treatment, and organ transplantation. As a teaching hospital affiliated with the University of Calgary, it's also at the forefront of medical research and training for future healthcare professionals. The Peter Lougheed Centre, located in northeast Calgary, is another crucial acute care hospital serving a large and diverse population. It's known for its busy emergency department and provides a wide array of medical and surgical services. The hospital has significant programs in areas such as general surgery, internal medicine, and women's health. It also features a neonatal intensive care unit, or NICU, that provides specialized care for premature and critically ill newborns. The Peter Lougheed Centre is committed to providing accessible, high-quality care to its community, continually adapting to meet growing demands and evolving healthcare needs in its catchment area. Serving the southern part of Calgary, the Rockyview General Hospital offers a broad spectrum of medical and surgical services. It's particularly recognized for its expertise in urology, housing a comprehensive urological center, and for its specialized ophthalmology programs. The hospital provides extensive inpatient and outpatient services, including general medicine, surgery, and critical care. Rockyview General Hospital plays an essential role in the city's healthcare fabric, offering care to a significant portion of Calgary's population and contributing to specialized medical fields. Its long history in the community is marked by continuous growth and service development. The South Health Campus, one of Calgary's newest hospitals, was designed with a focus on patient and family-centered care, wellness, and innovation. Located in the rapidly growing south end of the city, it offers a full range of acute care services, including an emergency department, critical care, and various specialized programs. Its design incorporates natural light and spaces intended to promote healing. Finally, the Alberta Children's Hospital is a world-class facility dedicated exclusively to the care of children from birth to age 18. It provides comprehensive pediatric services, including specialized surgery, cancer care, and mental health services, all within a child-friendly environment. It's also a leading center for pediatric research. In the Canadian healthcare system, family doctors, also known as general practitioners or GPs, are incredibly important. They're often the first person a patient sees when they have a health concern. This makes them the main entry point into the wider healthcare system for most Canadians. Family doctors provide what is called primary healthcare. This includes diagnosing and treating common illnesses and injuries, managing chronic conditions like diabetes or high blood pressure, and providing advice on staying healthy. They're trained to care for people of all ages, from infants to seniors, often looking after multiple generations within the same family. Having a regular family doctor offers significant benefits for patients. One of the most important is continuity of care. When you have a consistent relationship with a family doctor, they get to know your medical history, your lifestyle, and your personal circumstances. This deep understanding allows them to provide more personalized and effective care. They can track changes in your health over time, identify potential problems earlier, and manage your overall health plan more effectively. This long-term relationship builds trust and can lead to better health outcomes, as patients may feel more comfortable discussing sensitive issues with a familiar physician. family doctors play a crucial role in preventative care and early detection of diseases. They perform routine checkups, administer immunizations, and conduct screenings for conditions like cancer, heart disease, and diabetes. By identifying health risks early, family doctors can help patients make lifestyle changes or start treatments that can prevent serious illnesses from developing or progressing. This proactive approach to health not only improves individual well-being, but also helps to reduce the burden on more specialized and expensive parts of the healthcare system, such as emergency rooms and specialist clinics. Their focus on prevention is a key element of a sustainable health system. Beyond direct patient care, family doctors act as navigators and advocates within the complex healthcare system. When a patient needs more specialized care, the family doctor is usually the one who makes the referral to a specialist. They help coordinate care between different providers, ensuring that information is shared and treatment plans are cohesive. Family doctors can also help patients understand complex medical information, discuss treatment options, and make informed decisions about their health. In many ways, they serve as a trusted guide, helping patients access the appropriate care at the appropriate time and making sure the system works for the individual. Despite the critical role of family doctors, Canada, including cities like Calgary, is currently facing a significant shortage of these essential healthcare providers. There are, several factors that contribute to this challenge. An aging physician population means that many family doctors are retiring or, nearing retirement. At the same time, fewer medical school graduates are choosing family medicine as their specialty, often opting for more specialized and sometimes more lucrative fields. The administrative burden on family doctors has also increased, taking time away from direct patient care. Furthermore, Canada's growing and aging population means there is simply more demand for primary care services than ever before. This shortage of family doctors has a direct impact on patients. Many Canadians, including Calgarians, find it incredibly difficult to find a family doctor who is accepting new patients. Online registries and provincial Find a Doctor programs exist, but waiting lists can be very long, sometimes stretching for months or even years. Even those who have a family doctor may experience challenges in getting timely appointments, particularly for non-urgent issues. This can lead to frustration and anxiety for patients and may result in delayed diagnosis or treatment for some conditions. The lack of accessible primary care can also put extra pressure on emergency departments. In the absence of readily available family doctors, many people turn to walk-in clinics for their primary care needs. Walk-in clinics offer a valuable service by providing access to medical care without an appointment, often for acute but non-life-threatening issues like infections, minor injuries, or prescription renewals. While they provide convenience and fill an important gap, walk-in clinics typically do not offer the same continuity of care as a regular family doctor. Patients may see a different doctor each time, and the clinic may not have access to their full medical history. This can make managing chronic conditions or complex health issues more challenging. Beyond walk-in clinics, other alternatives for accessing care exist. Community health centers, often run by Alberta Health Services or nonprofit organizations, can provide primary care services, particularly to vulnerable populations. Some provinces are also increasingly utilizing virtual care platforms, allowing patients to consult with doctors remotely via phone or video. For issues that are more serious than a walk-in clinic can handle, but not severe enough for an emergency room, urgent care centers offer another option. These centers can treat conditions like broken bones, sprains, or infections requiring prompt attention. Navigating these various options can be confusing, highlighting the ongoing need for more family doctors. In the Canadian healthcare system, accessing the services of a medical specialist, such as a cardiologist, dermatologist, or orthopedic surgeon, typically requires a referral. This means that your family doctor or a doctor at a walk-in clinic or urgent care center must first assess your condition and determine that you need specialized care. If they agree that a specialist consultation is necessary, they will then formally refer you to the appropriate specialist. This referral usually includes information about your medical history and the reason for the consultation, helping the specialist understand your needs before your appointment. This system is a fundamental part of how care is organized. The referral system serves several important functions. Firstly, it helps to ensure that specialists are seeing patients who genuinely require their specific expertise. Family doctors are trained to manage a wide range of common health problems, and many issues can be effectively treated at the primary care level. By acting as gatekeepers, family doctors can prevent unnecessary specialist visits, which helps to manage wait times and ensures that those with the most pressing needs can be seen more quickly. Secondly, the referral process allows the family doctor to remain the central coordinator of a patient's overall health care, maintaining a comprehensive overview of their treatments and conditions. Once a referral is made by your family doctor, the process of getting an appointment with a specialist begins. The family doctor's office will usually send the referral directly to the specialist's office. The specialist's office will then typically contact you, the patient, to schedule an appointment. It's important to understand that there can often be a waiting period between the referral and the actual appointment. Wait times for specialists can vary significantly depending on the type of specialty, the urgency of your condition, and the demand for services in your area. In some cases, particularly for non-urgent issues, these waits can be lengthy. While the referral system is the standard pathway, there are some limited exceptions. For instance, in an emergency situation, you would go directly to a hospital emergency department, and specialists would be involved as needed without a prior family doctor referral. Some specific services, like certain sexual health clinics or, in some provinces, direct access to physiotherapy for certain conditions, might not always require a referral. However, for the vast majority of specialist consultations within the publicly funded system, the referral from a primary care physician is a necessary first step. This ensures a structured approach to accessing specialized medical expertise. The Canadian healthcare system, often referred to as Medicare, is largely publicly funded. This means that medically necessary hospital services and physician services are paid for through taxes, rather than by patients at the point of service. The Canada Health Act sets out the national standards that provincial and territorial health insurance plans must meet to receive federal funding. These core services, such as visits to a family doctor, specialist consultations, hospital stays, and surgical procedures deemed medically necessary, are covered for all eligible residents. This public funding model is designed to ensure that access to essential care is based on need, not on an individual's ability to pay. However, it's important to understand that not all health services are covered by public funds under Medicare. Many services fall outside the scope of what provincial health insurance plans pay for. Common examples include most prescription drugs taken outside of a hospital setting, dental care like visits to the dentist, cleanings and fillings, vision care such as eyeglasses, contact lenses, and often optometrist visits for eye exams, and services from other health professionals like physiotherapists, chiropractors, and psychologists in private practice. Cosmetic surgery that is not medically necessary is also generally not covered. This means Canadians often have to pay for these services themselves. To help cover the costs of these non-insured services, many Canadians rely on private health insurance. This private insurance is often provided as a benefit through employment, where the employer pays all or part of the premium. Individuals can also purchase private health insurance plans directly from insurance companies if they don't have access to a group plan. These private plans typically help pay for things like prescription medications, dental checkups and treatments, new eyeglasses, and paramedical services like massage therapy or physiotherapy. The extent of coverage can vary widely depending on the specific plan, with different plans having different deductibles, co-payments, and annual maximums. Even with a combination of public coverage and private insurance, Canadians may still face some out-of-pocket expenses for healthcare. For example, private insurance plans often require a deductible to be paid before coverage kicks in, or they may only cover a certain percentage of the cost, leaving the patient to pay the remainder, a co-payment or co-insurance. There might also be annual or lifetime limits on how much the plan will pay for certain services. For individuals without private insurance, the costs of services like dental care or prescription drugs can be a significant financial burden. This mix of public and private funding creates a hybrid system in Canada. When discussing healthcare, comparisons between Canada and the United States are common, as the two neighboring countries have very different approaches. Canada operates primarily under a universal, single-payer system, where provincial governments fund medically necessary hospital and physician services for all residents through taxes. The United States, in contrast, has a multi-payer system, with a patchwork of private insurance, often employer-sponsored government programs for specific groups like Medicare for seniors and Medicaid for low-income individuals, and a significant number of people who are uninsured or underinsured. This fundamental difference in structure leads to vastly different experiences regarding access and coverage. In terms of cost, the United States consistently spends significantly more on healthcare per person and as a percentage of its gross domestic product than Canada does. Despite this higher spending, the United States does not provide universal coverage, and medical debt is a major issue for many American families. Canada's single-payer system generally has lower administrative costs compared to the complex web of insurers and billing practices in the United States. While Canadians pay for healthcare through their taxes, they typically do not face large bills for doctor visits or hospital stays for insured services. Unlike many in the United States who can incur substantial out-of-pocket expenses even with insurance. A frequently cited challenge in the Canadian system is wait times, particularly for elective non-emergency surgeries and appointments with some specialists. While urgent care is generally timely, patients in Canada may wait longer for procedures like hip replacements or cataract surgery compared to the United States, where those with good insurance or the ability to pay privately can often access such services more quickly. However, it's important to note that access in the United States is heavily dependent on insurance status and financial resources, meaning many Americans also face significant barriers and delays in receiving care, sometimes due to cost rather than system capacity. When it comes to health outcomes, the picture is nuanced. Canada often performs similarly to or better than the United States on several key health indicators, such as life expectancy and infant mortality, despite spending considerably less per capita. For example, Canadians generally live longer than Americans. However, both countries face challenges in areas like managing chronic diseases and addressing health disparities among different population groups. Neither system is perfect, and both countries continuously explore ways to improve efficiency, access, and quality of care. The core difference lies in Canada's societal commitment to healthcare as a right for all versus the more market-driven approach in the United States. Calgary benefits from a robust network of hospitals and healthcare facilities managed under the umbrella of Alberta Health Services. These institutions, from the highly specialized Foothills Medical Centre to community-focused sites like the South Health Campus and the dedicated Alberta Children's Hospital, provide a wide range of medical services. They handle everything from emergency interventions and complex surgeries to routine care and public health initiatives. This integrated network aims to serve the diverse and growing population of Calgary, ensuring that residents have access to necessary medical attention when they need it, forming a cornerstone of community well-being in the city. The role of family doctors remains absolutely vital within Calgary's and Canada's healthcare framework. These primary care physicians are the first point of contact for most health concerns, offering continuous, comprehensive care and crucial preventative services. They guide patients through the system, making referrals to specialists and coordinating treatment plans. However, as discussed, Calgary, like many parts of Canada, faces challenges in ensuring everyone has timely access to a family doctor. This shortage underscores the ongoing need for strategies to recruit and retain more family physicians to maintain the strength of this foundational aspect of Canadian healthcare. The guiding principle of the Canadian healthcare system, deeply embedded in how services are delivered in Calgary, is universal access. This means that essential medical care should be available to all residents based on their need, rather than their ability to pay. This commitment is enshrined in the Canada Health Act and is a source of national pride. It ensures that a medical emergency or serious illness does not automatically lead to financial ruin for individuals and families. This focus on equity is a defining characteristic that distinguishes Canadian healthcare, aiming to provide a safety net for everyone in times of medical need. However, this commitment to universal access and cost control comes with inherent trade-offs. The most frequently discussed compromise is the issue of wait times for certain non-urgent procedures and specialist appointments. While the system excels at providing urgent care, the demand for elective treatments can sometimes outstrip available resources, leading to delays. The Canadian healthcare system, including its delivery in Calgary, is constantly striving to find the right balance between providing universal, high-quality care and managing resources effectively. It's a dynamic system that continues to evolve, seeking to uphold its core values while addressing the challenges of a modern healthcare landscape.